say it because it's patient safety. And the same thing on the defense side. If the surgeon has not done the right job, you'd love to defend him, but sometimes you just have to say, I can't defend this case. I can't. Once again, patient safety. Be honest and unbiased. We don't want people out there starting to look at our society and say that we're a bunch of hired guns. Marketing and advertising. We're all not perfect. We all have had complications if you've done enough of these. And how many websites will say that I'm the best and the most experienced in my area, and then the hospital next door, he's the best and most experienced in the area. Be honest. Be honest in how you portray your program to your patients and to the public. And again, the informed consent process. There is a ritual with informed consent. It is a process. There's a lot of papers written about informed consent, but you have to answer all the patient's questions. You have to discuss all treatment options. You have to make sure that when the patient signs the consent form, that they understand the procedure as well as they should understand the procedure, and the process, and the aftercare, and the complications, and the expectations, and everything that goes along with it. And in bariatric surgery, if you look in obesity research in 2005, this is out of the Betsy Lehman report, you can see that there's actually not so much a template, but at least a suggestion of what a bariatric patient needs to know when you do informed consent. I spend 1 hour with the patient doing informed consent. I spend 15 minutes consenting a patient for a lap chole. There's a difference here. Remember that. So in summary, the field of bariatric surgery today, as I reflect now in my career in it, has never been more exciting, more successful, more relevant, and I owe all that to everybody here and everybody in our society and all of our colleagues and partners because we've done this together. The American Society for Metabolic and Bariatric Surgery is the recognized authority on metabolic and bariatric surgery, and we've worked very hard to get there. So I want to say that I am honored and privileged to consider myself a bariatric surgeon. I'm not a stomach stapler, and I'll never let anybody say less of that. I'm honored and privileged to be a member of this society, and have always been. And I am honored and privileged that you have felt the confidence to allow me to be your president for the last year. And with that, I thank you all. Thank you very much.